You're ready, let's get it going. Okay, so I guess I need to bring the meeting to order of the Health Committee, August 1st, 9:30 a.m. Members, you take a roll call.
Yeah.
That's right.
Kokenauer,
Here.
Awful,
Here.
Persley,
Present.
Whitlow.
Here. I guess we call the meeting to order. First line on the agenda is public comments. Does anybody got any public comments? That's not. No, this is not very well. Agency reports. Who would like to go first? No agencies? County Health? Yee?
Okay, thank you. Good morning.
Dave?
So, as you know, there has been some kind of a state budget that's supposed to be, going through. In May, on the May 2nd Health Committee meeting, I had reported to you that the state of Illinois owed us $81,812. The state owes as of yesterday, the state owes ICPHD $32,741.37, and that's from the state fiscal year 2017, which was July 1st of 2016 through June 30th of 2017. So that's not too bad. At any given moment, they owe us that. So on a normal year. So I think
You said 32,000?
32,000. Yeah.
Jeez, that's a long ways from where we were.
Yeah, it's a long way from where we were. I handed out the grants and contracts list to you. We are still waiting on the following grants and contracts from the state, and I attended the Illinois Association of Public Health Administrators regional meeting in Champaign last Friday. We meet every other month in Champaign, and then the full membership, statewide membership, meets on the opposite month in Springfield. And we were sharing information on our grants and contracts, and no one has these yet. No one. So the state's just behind. But the contracts that you can see that we're still waiting on are the body art control, child and adult care, food program, canning program, summer food, local health protection grant, and our lead grant. Now, I do want to let you know on those ones that we're waiting on summer food, they did send us a list. The state did send us a list of Iroquois County applications and who were to inspect for that, and told us that the application would be coming soon and to move forward that we would be paid. They just don't have it ready to go into the eGrant system yet. For local health protection grant, you can see that we were told that it was coming soon. On last Friday's meeting, we were told that it should come into eGrant sometime this week. So that's one of our larger grants, local health protection grant. I do want to remind you that, and I know I've spoken to you about this before, but local health protection grant is the state provision or state allocation for those things we don't have other grants for. Local health protection grant is $63,201. It's been that same amount for years. It'll continue, as far as I know, to be that same amount. But in the new state budget that was approved in July, they did appropriate an additional $1 million into that local health protection grant. I don't know where that appropriation will fall, so we don't have any knowledge of whether that will change us or not. But that's the minimum amount for our population size for our county. That is supposed to cover, food, water, septic, communicable disease, tuberculosis, all of our investigations. Obviously, it's just kind of like a little stipend money. It doesn't cover those things, So, but we still want it. And our lead grant, I did receive an email, and they gave us new formulas, and they're basing the lead grant amount this year based on whether or not, how many high lead screenings you have, what percentage of your lead screenings last year were above the normal limit. So according to the formula that they gave me, if I calculated it correctly, we should get, when we get that grant should be around $2,500. So it'll be an increase. Now, there's no guarantee. We'll see what happens when we actually get it. Sometimes the state says one thing and then you get it and it's another thing, but that's what I'm anticipating and that's what I expect at this point in time. Until I know differently, but I'll let you know if we find out differently. And then on the Illinois Department of Revenue Enforcement, the liquor control enforcement, where they're paying us the $75 fee to go out and do the 79 establishments in Iroquois County. The state is contracting with us to do that. The training for that is going to be on August 10th. I have both Terry Eyman and Chris scheduled to go to that training, and then we'll be implementing that program. And the state will be paying us 50% because they give you the list of who you inspect. So they're going to pay us 50% up front, and then 50%, the other 50% when we complete all 79 inspections.
So it costs us nothing.
No, in fact, we're going to be there anyway doing the restaurant inspections.
I like to hear that.
It's a great contract. Any other questions with the grants and contracts report?
You said, I have a question.
Sure.
You said that they tell you who you inspect.
Yes.
Does that cover all of our, do you send them a list of who they?
No, they send us the list. That list comes from the Illinois Liquor Control Commission.
Oh, okay.
They send us a list of all their people who have applied to them for that. And then they send us that list, and then those are the ones we inspect.
But that covers all of ours.
That covers all of Iroquois County, yes. Yes.
All right.
The next thing I'm going to give you, any other questions on that? I'll give you the program summary report. Go ahead and pass those around. I wanted to go over this with you a little bit this time. Some meetings, I just give you the list and just kind of, it's pretty self-explanatory. But this time I thought that I needed to go over it with you because there are a few errors on my list this time. I never presented a list to you before that had some typos, but I found typos at the end of the day yesterday and just didn't retype it. I thought I'd tell you.
It's okay. Save the ink and paper.
Okay, thank you. Okay. So, let me go over mine of my highlighted things. So, under environmental health, you can see that we did, 34 food sanitation inspections. Under temporary permits issued, we average anywhere, 5 to 8, 9, some months there's 10, some months there's 7. We have 32, obviously, in June. You can figure out what the 32 is from. It's from the fair and from festivals and town events that are going on. Typically, that number always picks up in the summer. We did have 4 food complaints that required investigation this month.
Like what?
The public would call in and say that they went to, for example, they may call and say, my husband and I ate at a restaurant and we both got diarrhea. And so then we go in and make sure that their temperatures are correct and they're, we do an inspection. Sometimes we get complaints as simple as, it's really dirty and the food handlers were not wearing gloves and, that kind of thing. But we do, once we get a food complaint, we do go to an investigation. We did 2 farmers market inspections. If you skip down, after the water samples and the wells, if you skip down to the private sewage disposal, you'll see that we did the 6 disposal site inspections. What Terry does with that is called a state, and whoever's licensed, the state will provide us with those disposal sites, and then Terry will go to the investigation. The West Nile virus, mosquito sample surveillance, we did 47 during July. The surrounding counties have had positive West Nile virus mosquito
Burgundy, another
samples,
one.
and some of them have actual cases. We have not in Iroquois County at this time. But if it's surrounding us, you know it's probably here too. But we are actively doing surveillance to see that so far none of our samples have come back positive. You can see the high number of radon kits we did. We gave away 74 radon kits this month, and that was due to the fair. We, anybody who came to the booth at the fair, we offered them a free radon kit. The radon kits are even prepaid postage so that people can have their homes tested for radon. Radon, as you know, is a gas that is naturally formed from the breakdown of uranium in soil, and that gas can be harmful, very harmful. It's the second leading cause of lung cancer in the United States.
Are these the kits, the number you handed out, or the
Yes.
number that you actually got back and actually tested?
No, those are the ones we handed out.
So you don't really have an idea of how many actually used them?
We will.
Oh, okay, so that,
Right now, I can tell you that, and this is a guess, Kevin, without just really doing the math, but I would say about 80% of them get used and about 20% you hand out, people don't do it.
that's average. Yeah. Just curious.
Yeah. I do want to make you aware that a few months ago, under the environmental stuff, I had told you that I would be bringing to the health committee the new food ordinance with the FDA food code. The state is still working on it, and that's been months. What had happened was we had taken the FDA food code and the state code, and we had Sherry had made the adjustments on the county ordinance. We took it to Jim Devine. He approved it. I took it to the Board of Health. They approved it. And then we were notified by the state of Illinois that they were going to make changes and don't do anything with your ordinances yet. So we're still waiting on that. So I don't have anything to bring to you, and I bet money I won't have anything to bring to you in the next month. We don't know when the state's going to have that done. So we're still waiting. But as soon as they notify us of what part of the FDA food code they're adopting and what part they're not adopting, then we will make our adjustments and bring it to you. Bring it to the Board of Health and back to the Board of Health and then back to you. And then you guys can take it to the full county board for approval, because that's the county ordinance. So, on the next page, under immunization, our immunization rates, I keep telling you, keep going up. They do. We did 133 childhood immunizations in July. Last year, in 2016, in July, we did 54. So those are really climbing.
But this is part of the school kids now starting to get theirs too, right?
Yeah, we always have more in the summer months anyway than we do. We typically do June through the October 15th school deadline. We typically are busy doing that. But like I said, last year we gave 54. This year it's 133. So our numbers have really climbed. We're the only VFC provider now in the county.
Right.
So that is, I'm expecting that to keep climbing. Obviously, the flu clinics are at zero. We're not giving flu shots yet, but I will tell you that we will be busy this month during the month of August setting up all of our flu clinics. We usually have all of those set up during the month of August, and we usually typically start either the last week of September or the first week of October, and do that. And because IMH is not going to be doing, have told us that they're not going to be doing outside flu clinics this year at all. I expect our flu clinic numbers to increase as well. Last month, when you get down to the reportable communicable disease investigation, that's a pretty big list. I was so hoping that last month was our first month in months and months and months. We didn't have any chlamydia cases to report. I was hoping that would remain low, but we saw some cases. So, if you have any questions about the communicable diseases listed there, or those numbers, or how an investigation works on that, just feel free to ask. I know we discussed that a little bit, but I did tell you that I would bring some staff in to talk about a program for, 10 minutes or so we can always talk about any of that. Do you have any questions with the tuberculosis or, international travel consultations or anything like that? Developmental screening, there's a big list there. Those girls stay pretty busy. If you go to the next page, the error that I told you that we made was under the jail program, where it says inmates assessed, it says 0. Well, we always have, she does that. So there were 9. There were 9. That should be a 9 and not a 0. And then under the referred for follow-up, 2. That should be 2. Under school health services, where it says students served, and it says 0, that number should be 20. That number should be, under Ileana migrants, should be 24. And that's the nurse who takes care of that. Is the other one sitting there. But other than that, those were our only 2 under the jail program and under the school health services, where the numbers, we didn't get them correct on your report for you. The rest of the numbers are all correct. I double checked them.
Will you explain what Ileana Migrant is?
Yeah. The Ileana Migrant Head Start is located in Sheldon, and it's located in what used to be the Sheldon School District, but now is the Milford, part of the Milford School System, and they contract that building in the summer, and that's where the migrant workers' children are go for daycare. Yeah. So we make sure that all their immunizations are up to date. We make sure that they've all been TB skin tested, lead screened. Make sure that all the state requirements that would apply to any other school child in Illinois. Make sure that they're up to date on all that. Yeah. It's really important because you want to make sure that if they're migrating here from another country, that they're not active, they don't have an active CD case or any of that kind of stuff. So that kind of work and surveillance keeps not only that child safe, but our population safe as well. Do you have any questions under community health? What about under the senior services program, the adult protective services or community care programs? Do you have any questions about those numbers? They fluctuate. Typically we see higher numbers, in March and April than we do now, and for some reason this year the numbers were real low in March and April, and now they're creeping back up. So, but we eliminated one of those part-time positions, and so we only have 2 workers doing the senior service program. So they're extremely busy right now, but they're handling it. They're working their tails off. They're doing a great job. So any questions with that? Okay, so the next thing then I have for you is the ordinance. So this is, let you pass those around. Yeah, that'd be great. Thanks. So this ordinance is the ordinance that was pretty much written in response to, you have a copy of it, right? No? There we go. This ordinance, we took this ordinance last month. Okay, first of all, this is ordinance number 2014, and it's an ordinance governing water wells and water supplies in Iroquois County, Illinois. In lieu of the possibility of having ground wells, water wells that are in a restricted area where there's not supposed to be potable wells drilled, we thought that there needed to be an additional few lines put into the ordinance to protect Iroquois County's aquifer. Okay, so what you see highlighted on page 2 in yellow are the only changes that we're recommending, that the health department is recommending that the county make. So we presented this to the Board of Health on July 5th at the Board of Health meeting, and they approved this, and it approved me to send it to the Health Committee, and then obviously it will have to go from you to the full county board for approval. And what we added was, in those locations where an ordinance prohibiting the use of groundwater as potable water supply by the installation or use of potable water supply wells, or by any other method as it has been adopted by a municipal body or the county and approved by the EPA, no closed-loop wells may be installed or permitted. Non-potable water wells in this location may be permitted and installed if minimally the upper 20 feet of well casing is of steel well water casing and the non-potable water well is pressure grouted using neat cement grout only. The reason for this is because there have been lots of research and studies out there that if you're using, especially the upper 20 feet of the well, if you're using just a PVC pipe or something like that, the grout, because there are different types of grout that can be used, the grout does not provide an adequate seal to a PVC. We think that it's important, and Terry even showed me a video where they use dye to try to see if there was any leaking, or any contamination, and the dye even outran the camera on some of these. So it was very interesting to see. So it's our recommendation that if you use steel casing and neat cement grout, then you'll have a better seal. We can prevent contamination and try to keep the aquifer, the water, for everyone safe. So that is our recommendation.
I don't know if this is handled or not, but was this brought about because of the Howard Johnson,
Yes.
Because I
Absolutely.
assumed that.
Yeah.
So,
We
so you didn't find anything, you just
No.
decided that...
We think that, and they're not the only one in the county. Remember, some of the cities have adopted. Yeah.
I just...
So
That was the most recent.
Yeah, we feel that this would, adding this into the ordinance would at least try to do something to keep the drinking water safe, and that there wouldn't be contamination that could get into the aquifer.
Gotcha.
It's our job to keep you guys safe. We're trying to do our best to do that.
Okay.
And Terry said if he's much better at explaining some of this than I am, but he said if you had any questions, or he told me to let you know that if you have any questions about this, please feel free to call him. He would be happy to talk to you.
So none of the rest of it was changed?
Nothing, just that. Only what's highlighted in yellow. Otherwise, there's no changes whatsoever. And it's just on page 2.
Okay.
Okay, so today I brought with me 2 of my wonderful staff nurses. Teresa Castoni has worked for the health department or has public health experience for how many years, Teresa?
I've been at the health department 9 years. Yeah. I've been a nurse for 30.
And then we have Melissa McEwen, who we are very fortunate to have lured to our health department. She's been a wonderful asset, and she's been working with us almost a year now.
Right.
So they're going to talk to you a little bit today about the school nursing program, and I chose that for the topic today because they're not in school right now. So I thought that,
Awesome.
yes, John?
Don't you need a motion to approve your ordinance?
Yes. Yeah, that's my fault.
I'm sorry.
We need, I guess, we need to go backwards.
Is that okay? Okay.
And back to ordinance number 2014. Are we going to do anything about this, or what do you think?
I moved to accept
Any
it.
discussion?
I moved to accept it.
Do I have a second?
I'll second.
Have a second. Ordinance addition is approved. Voice vote, fine.
Aye.
Voice vote?
Aye.
Voice vote? I'm learning.
You have to ask your name.
Is there any nays, the opposite, whatever you call it, opposed, same sign? All right, now we can move on, my fault.
No, that's okay. Thank you, and thank you, John.
Thank you, John.
So, take it away, girls.
Okay. Well, as most of you probably assume, we treat all injuries and illnesses and emergencies for health concerns that arise in the course of the day at school. Unit 9 has approximately 1,000 children. I think our May count was 1,030 in 4 different buildings. So I carry a cell phone, and I start at a building I know I have things to do at, and then I go at the phone screen when they need me. On top of treating any illnesses and injuries that happen that day, I do a lot of other things. Primarily keep us in compliance with the state regulations. Depending on what grade you're entering, there are different things that are required, whether it's a new physical or certain immunizations, an eye exam or a dental exam or whatnot. I will track all that, every student, I will review every record, and then tally those figures up and report it back to the state computer system, which is called the IWA system. They're due at different times. Immunizations and physicals and eye exams are due by October 15th. Most parents will turn all that stuff in when they register for school. Some will drag you all the way out to October 15th. So I track all that and then follow up, and then we'll enter all that into the state system. Based on those physicals that I reviewed, if that child would have asthma or a seizure, medical history, or they're diabetic, then I would make sure there's a seizure action plan or an asthma action plan or a diabetic medical management plan. We currently in Waseca have 6 students who are insulin-dependent diabetics. I spend a lot of time monitoring sugars or counting carbs or giving insulin or just teaching. Not only do I do that for the students, but I do that with the parents. So I get a lot of questions from parents as well. So those things are required if you have certain medical conditions. So I make sure that all 1,000 students are up to snuff. I serve on the concussion management team. That happens more frequently than you would think, whether it be football or basketball or soccer or PE or falling off a music riser in fire or whatnot. So then we review their symptoms and return them to learn or return them to play based on their symptoms. There's a whole protocol involved in that. So I follow that. I monitor all of our students for head lice, and if we find it, and that happens a lot, I will instruct the parents on how to handle that situation, and then they have to be rechecked. Unit 9 has a no-knit policy, so they have to be checked before they can come back to school. If I would find nits, we'll kind of handle that on an individual basis. If I would find live head lice, then I go and check that whole classroom, and then, carry on through.
I volunteer for
Happens more than you think.
Yeah.
Same with, things that are contagious, get right on. Scabies, pink eye, head lice, those kind of things. I do a lot of health education talks with the staff, bloodborne pathogen training or AED training. I do a little bit of first aid with teachers that maybe are going on a field trip and I'm actively there, or diabetic education for symptoms to look for in the classroom. Obviously, I can't be in 4 buildings at once, so I just kind of give them a heads up on things that they should be alert, for, and things that they would need to contact me. I do wellness promotion, do a lot of blood pressure checks on the staff, flu clinics, just really health counseling on high cholesterol or personal medical issues that they come and just kind of pick my brain, or what do you think about this? And that happens a lot. I sit in on a lot of IEP, which is individual education plans, or 504 meetings. Those are children who have special needs and we need to make accommodations for those. So I'm involved in those meetings, and then we set forth a plan and make sure our students are safe and get what they need to be successful during the course of the day. I document all annual hearing and vision testing and then follow up on that. We have AEDs in all of our buildings, some that stay in the building, some that travel for sports, with the baseball team when they go, or whatever may be. So I monitor those and order supplies and that kind of thing. I'm really just a health resource person for the district. In the summertime, when I'm not at school, you guys probably wonder what I do. I kind of a little girl Friday. I fill in the office. I fill in for the vision and hearing tech. Like she mentioned, I go to Shelton and do the Inlay and a Migrant Head Start. I review their records and do some classroom observations to make sure there's no safety issues or storage issues that could be problems, things like that. I do community education outsource reaching within our community. For instance, I just did a babysitting class. Actually, this is all these things I'm saying. I should be saying we, because we both do all these. I went to the Park District and did a babysitting class. I've done some bullying prevention class. I'll be traveling over to Crescent to do EpiPen training. Any kids that have allergies, and we have quite a few in Unit 9, so that people know how to use the EpiPen to prevent anaphylactic shock. Lots of peanut allergies and treatment allergies, those kind of things. I review policies and procedures as we need it, and I just do kind of a girl Friday. So I love my job. I'm very proud of our district, and I hope that helps you understand what school nursing is all about. It's not just great surgery.
Kevin, can I ask a question? Is it staff that trains to use AEDs in these schools?
Yeah.
Thank you.
Yeah. Fortunately, in the 9 years I've been here, I've not had to use one.
Oh,
But
Yeah.
But we have them, they're ready to go, and we're prepared and ready.
The automatic external defibrillators. You're mandated by state regulation to have an AED in buildings that hold a certain number of people for events. So like most schools are required to have an AED by the gym, because the gym would hold a lot of people. Obviously, you want the AED there in case that something happens with a student or with a teacher, but you also want one there in case you have one for people who are visiting and coming for events.
More often than not, it will be somebody attending for an event.
Yeah, more than a kid, we hope. I mean,
I want to hear those stories where a very healthy
child.
high school athlete.
And as Dee said, I'm Melissa McEwen. I'm the school nurse in Milford. We have about a little over 600 kids. We did have 2 buildings. Now we're combining. I'm sure you guys have seen the construction project that's going on. So we'll have one building that we connected. Essentially, I do everything that Teresa just described. I guess I have the luxury of having the kids all pretty much under one roof. So one thing I can do that's a little bit different is, administer all the medications myself, because I am there, with them all the time. And I pretty much see, all of the entries and, things myself, because I am usually always there. Other than that, it's really pretty much like Teresa said. Like she said also, I absolutely love the job. And
No 2 days are the same.
never, ever the
You
same.
never know.
Never the same.
I was a school nurse, as you know, contracted through the health department for almost 18 years. It is a very exhausting job, but a very rewarding job, and you can't imagine the other things that you do. People think about a school nurse sitting in a room and waiting for an ill or injured child to come in. That is nothing close to that. You end up doing so much more than you would ever imagine doing. Every time a child wets their pants, they send them, go see the nurse. She'll change your clothes. Kindergartner kids, have an accident, or there are years that things are not so hectic, and then there are years when things are very hectic. And I can remember one year having a student that had to be his trach had to be suctioned twice a day, and at that same time, that same year, I had 2 students who had to be catheterized every 4 hours, and then we had Woodland School, and I had diabetic students in all the buildings, and so I'm running back in. So every day, I barely made it from one building to the next to get everything taken care of. And if there was, like somebody broke their arm in PE, then it just threw everything off. So there are years when if you have a lot of special needs students in the district, you just run all day long, and you. As a school nurse, you never get a regular lunch break, ever, because that's when the kids are outside playing PE, and that's when they hit their heads or whatever. So you might get your lunch break from 2 to 3, or you might get, and then have to go back to work from 3 to 4. You just don't know. You have to be really flexible, and you just have to go with the flow. But I will tell you that both of these girls, I was as well, have taken special training. An EMSC course. It's an Emergency Services for Children training course that prepares them on with assessments and with assessing injuries, and just adds a little bit more knowledge about emergencies and that could go on in the school. It was something that I wanted the girls to make sure that they completed, and they did.
Back to the AED, I know that as an official, I'm not required to do it, but I have taken a class on AED, and the IHSA actually requires that. Do you teach all your teachers, obviously, for the AED?
And you would be anyone else? Were you going to ask about liability? Is that where you're going with that? Yeah, and that's the first thing that people always ask. You would be covered under the Good Samaritan.
And then the calling of in law.
Right.
We are
Also
not
protects
liable
you.
we are not liable for that.
No, you would be covered. And it's just, they walk you through step by step. So you'll run off adrenaline, and better to help attempt than to not.
Those things tend to make people nervous. So when we purchased them for Unit 9, and when we purchased help give a recommendation for Melbourne to purchase theirs, we purchased ours here for this building. I made sure that we spent a little bit of extra money, and instead of getting a semi-automatic AED, we got a fully automatic AED. What happens is people tend to, even if they open it up, the machine will talk you through it, you place the pads. Just pushing that button makes people nervous. They hesitate, and those seconds count, especially in a cardiac emergency. So I made sure that all of those are fully automatic. So once you put the pads on, the machine takes over completely. It determines whether you need different relations, and then it will say stand clear, super shock advice, yeah. So the machine makes the determination whether to do that. You don't have to push the
Person
button.
just needs to apply the pass.
Right, that's what I did.
So where's that at?
We also have. to-
In our office.
In your office.
You're seeing a lot more of that.
Yeah, that's
Yeah.
required.
In our lab, where we give you
You can't
immunization.
get your
Okay.
license without taking a concussion.
Yeah.
Okay.
Well, you girls are very appreciative.
Thank
you.
you. Yeah.
Yes, thank you very, very much. We know you guys are very, very important.
Yeah,
Really.
thank you.
I feel that way, so.
Thank you.
So
Anything else, Dee?
no, just for our next meeting on September 5th, I thought maybe I would ask you guys what you would like to hear. So if you would take a look at our program summary report, if you have something that you'd like to know more about, one of our programs or services, name it, and I'll bring that staff member or staff members who work in those, so that you can get to know my staff and you can get to know more about the program.
Know what we offer.
Yeah.
Some people don't realize that.
No.
About the health department.
Let me know what you'd like for me to bring next month. You don't have to let me know today. You can shoot me an email or give me a call. Otherwise, I'll pick a topic based on who's available that day.
Yeah,
Sounds good.
I like how you did this.
Thank you.
Thank you.
Appreciate it very
You
much.
guys have a great day.
You too.
Thank you. All
Won't be
right.
long, you'll be in school.
I know, it's coming. Thank you.
Bye.
Bye-bye.
Comforting.
Yeah,
Thank you.
comforting them.
Next item is old business. Any old business?
I don't know.
Do I need to go back down on that ordinance approval to make sure it's in the minutes that it's sent to the category for schools?
The motion that was made and
So that's kind of what I make, okay, my fault.
that was,
Just making sure we're trying to do things the right way.
there'll be some heading on the agenda, but the county board about that, so the report is approved, the ordinance is approved.
Okay.
Or somebody separates it out.
Right.
But
Yeah, well aware of that. Thank you, John, appreciate it. No old business, new business? Great, I guess we can adjourn. So moved.
Second.
What did I say now? Meeting adjourned.
You did get that.
Thank you for your help, man.